All right, everyone. Hello. This is Dana Salisbury, and I have a special guest here with me today, the beautiful Miss Amber. And welcome. And we're here at the Townie meeting. I mildly stalked you. And anyway, about 2 weeks ago, Sandy Pardue, as many of you know, is also my mother, shared a video, Amber's video, on Facebook. And the story just touched me so much. I thought, this is such an amazing person. I really identified with you as a mother, just as a girl in her 30s, like just, you know, living life and going along with things like everyone does, and getting caught in the day-to-day grind. And so she, thanks to a wonderful hygienist that was doing her job very diligently and thoroughly, encouraged her to have an oral cancer screening. So Amber, I'd like for you to tell a little bit about just how this was discovered and your story.
Okay, thank you so much for having me. Sorry for my voice. I was 35. We had just recently purchased our home, so I set up a new patient exam at the local dentist. And when I went in, they offered a panoramic screening, and then they also offered a Velscope oral cancer screening for a $20 fee. So when we did those two things, it came back that I had a dark spot on my x-ray in the jawline area. The physician and the hygienist at that point then they took me back. It did 25 extra x-rays for me to take to the oral surgeon just so they find the proper area. And when I got to the oral surgeon and we did 3D imaging, I actually had a tumor the size of a golf ball growing inside my mandible. And there was no way to tell because it was slowly breaking my jaw, but at the same time it was pushing the nerve out of the way, so I couldn't tell that there was anything going on.
And you did show me a picture just as the day of the morning of the surgery, and you look completely like symmetrical. Like this is not.
Yeah, there's no
sign externally
that anything was happening. So after we got the biopsy done and back, it came back as one of the rarest cancers in the world, clear cell undogenical carcinoma. And it's 95% aggressive. It's not treatable with chemo or radiation, and it literally has no survivors. So I'm the only one here. And I wouldn't have been here if the hygienist and the dentist hadn't taken the opportunity to do a proper screening. And so I don't fit the stereotype that you would normally think of for oral cancer.
Right.
You know, I was healthy.
You're not a smoker.
I wasn't a smoker. I was in good shape.
No tobacco.
No tobacco.
Right.
I wasn't dipping. And it wasn't a social or environmental thing. It was just luck of the draw.
Right.
But I'm very thankful that they actually went above and beyond to do that for me.
Yeah, absolutely. Yeah. And just Amber has touched me so much because she has used her diagnosis for so much good. She is here at the Dentaltown meeting. And when I saw her, I said, "Are you in dentistry?" Because, I mean, I don't know. I don't know.
No, I'm not in dentistry. Actually, through my diagnosis, I was put in touch with the Oral Cancer Cause, which reached out to me and helped me in a time where I had nowhere to turn.
Yeah.
There was no support group. There was nothing out there for me. I couldn't talk to anybody. There was nobody to go to. And they connected me with people who had had similar surgeries. They connected me with the other known survivor of this type of cancer because they had helped him the year before.
Yeah.
And then all of a sudden a check showed up to put my son into daycare while I was going through recovery because I couldn't lift him. And I didn't think about that.
Right.
And it was such a relief in such a dark time. And so now I have the opportunity to go around and talk to dentists and hygienists about the importance of doing screenings, share my story, and help other oral cancer patients through this process.
Yeah, and you're I mean, my hero, because you're you know, so many things happen to so many of us and on different scales, and most people don't follow like your example here of using what happened to you for so much good and to raise oral cancer awareness. I'm chewing gum, which I think is an ugly habit, but it's a thing. You're supposed to blow bubbles for those with oral cancer that cannot. So you have just paved this path. I mean, for so many, especially me and my heart, and I love that you get your strength obviously from other people. Helping others, and this means a lot. This means a lot to our industry, where so many people are just ignorant to oral cancer and the risks.
I didn't, it's hard to explain, but as you listen to the doctors say things like, there's no known cause, like there's no known cures, there's no other survivors. There's no one to turn to, and we don't even know how to treat this.
Right.
That I literally walked outside and went to Google because that's what we do, right? I was like Google. I tried to WebMD myself into a different diagnosis, anything. I wouldn't have taken anything under the sun.
Yeah.
But there was nothing. There was not even any information about the cases. I had to literally search and buy the case studies from 25 years ago, third world countries, just to maybe get an idea of what we were looking at. And at that point, those were not very lighthearted.
Right.
It was a lot of people with metastasized lung cancer. It took their life, and it just continuously came back. And even my other survivor of this type of cancer, Tim, I call him my cancer brother. He's had 3 reoccurrences in less than 3 years. And they keep continuously doing the same surgery because that's all we can do.
Right.
It's hope we get wide enough margins and hope that it doesn't come back and raise awareness along the way.
Oh, wow. That's right. And it is up to you hygienists out there and dentists, front desk team members, all of you. Make it a standard in your office. I know in a lot of offices, people don't want to ask the patient to pay for even a fluoride treatment, which is a couple bucks. But when you use the word cancer, guys, this is cancer. And I mean, for an unknown cancer to pop up in Amber's life here, it can happen to anyone. So save lives. I cannot encourage this enough. Ask your patients, encourage them, push them along. It is the best thing for them. They need this, and just you can do so much good.
I even as a patient, there was no pushback. Immediately she said, "Would you like to do this? It's a $20 fee," and I was like, "Absolutely." Yeah. I didn't know that $20 was going to save my life.
And you wouldn't be alive today, most likely, right?
No, I wouldn't have. I was already at stage 2, stage 3. So it would have been a silent killer and would have been found by autopsy had I not been fortunate enough to be in that dental office that day and then go above and beyond for us. And we wouldn't have known.
For $20.
$20. I know.
$20.
I spend less amount of coffee during the week, which is probably not a good habit, but still.
Yeah. But it puts things into perspective. And $20, guys. Team members, just encourage everyone, each other. Just start. Make this a standard.
And you have to consider the fact that HPV is on the rise, and it's the leading cause of oral cancer between the age demographic of 20 and 40. It's not 40 to 60. It's not a smoker that's been, ruining their own life for many, many years. It's something that people are very unaware of, and it's just going to, I think, become more prevalent in our practices.
Absolutely. Amber, thank you so much for being here today.
Thank you for having me.
She's my hero. She's a wonderful person. And so I hope to maybe see her at a future dental meeting.
Oh, I'd
maybe we'll make this a habit.
I know, hopefully.
All right. Thanks for joining us, you guys.
Thank you.
Okay.